Hello everyone, my name is Jun Yoon. I am an undergraduate student at Emory University. Today I will give a presentation on South Korean suicide prevention strategies and actions taken before and during the coronavirus pandemic. The aim of this research is to analyze the impact that the coronavirus pandemic had on the suicide rates on South Korea and evaluate different policies enacted by governmental and non-governmental organizations. Suicide is a significant cause of death globally. In 2017, the total number of suicide was 793,823, making it the 15th leading cause of death next to HIV/AIDS and tuberculosis. The following figure shows the age standardized suicide rates. It can be seen that South Korea has the highest suicide rates of more than 15 suicides per 100,000 people. Statistics from the Global Burden of Disease Collaborative Network shows that suicide was the 5th leading cause of death in South Korea, and 5% of all deaths were attributed to suicide, compared to the global average of 1.4% in the same year. The following figure shows the share of deaths from suicide in South Korea from 1990 to 2017. Since 1990, the suicide rates have steadily increased, starting from approximately 2% till 2010, increasing approximately 6.5%, and then steadily declined after 2010. The following figure from the IHME report shows the global suicide rates by age bracket in 2017. An overall trend of an increase in suicide rates can be observed with an increase in age, with 0.63 per 100,000 for 5 to 14 years age group, and 27.45 per 100,000 for the 70 plus years age group. The following figure shows the suicide rates by age in South Korea in 2017. The overall trend shown in suicide rate is similar to global suicide rates. However, it can be observed that the suicide rates for all the age groups are significantly higher, and that the 70 plus years age group has a significantly high suicide rate of 86.04 per 100,000 individuals. These statistics makes clear that suicide is more prevalent in South Korea than the world average is. The data is especially significant in the population over 70, which is 3 times the world average, and in the population between 15 to 49, which is almost 3 times the world average, and is still profoundly higher in the other 2 age cohorts at 2 times higher. In 2019, the Republic of Korea Ministry of Health Center for Suicide Prevention issued a white paper analyzing the country's suicides and demographic factors. As a previous chart showed, suicide declined since 2011, but the rate is more than 3 times than the OECD average, and 1.5 times higher than Slovenia, the country that ranks second among elderly suicides in the club of rich and developed nations. South Korea previously occupied the number 1 position in overall suicides in the OECD, but the most recent data shows South Korea ranks second after Lithuania. Also, more than half of suicide victims in South Korea in 2017 were either not in the workforce or unemployed, according to the government white paper. A total of 12,463 people committed suicide in 2017, down 4.8% from the previous year. Cause of suicide differed by age group, and the number 1 cause of death for victims ranging from age 30 to 59 was financial troubles. Then, we ought to ask the question, why is suicide rate for the age significantly higher than the world average in South Korea? Several studies have been conducted to look into the cause for this. For instance, research conducted in 2012 concluded that individuals who had higher risk of a stroke or had experienced a stroke evinced higher incidence of suicidal ideation and self-harm. Other studies showed that elderly in South Korea were less likely to have suicidal ideation and self-harm when interacting with family and grandchildren, and that isolation experienced by many elderlies in South Korea led to high suicide rates. It is also important to mention suicide rates in teens. According to statistics, suicide is the #1 cause of death for Koreans younger than 20. According to a health ministry study in 2019 reported that the overwhelming burden of qualifying for university has become the biggest reason that Korean teens commit suicide. For instance, students are forced to study for long hours, are constantly being compared to peers at school, and parents exert pressure on children to go to prestigious universities. According to an OECD survey, South Koreans have the second lowest happiness index score with a score of 6.2. Government statistics also showed that the coronavirus had considerable impact on suicide rates. For instance, the number of people who deliberately harmed themselves in the first half of 2020 soared nearly 36% compared to the same period last year. A record of 595,724 people have been treated for depression, up 5.58% in the first 6 months of 2019. In South Korea, the three most common methods of suicide in 2019 were death by hanging, carbon monoxide poisoning, and jumping from height. And the three most common motivations for suicide in 2019 were mental problems, financial difficulties, and physical problems. It was observed that the #1 motivation for suicide for men was financial issues, but for women it was mental problems. One important risk factor of suicide to consider is the taboo nature of mental health related issues in South Korea. Government statistics showed that 1 in 4 Koreans experience a mental health disorder at least once in their life, with only 1 in 10 pursuing professional treatment. Also, some suicide victims sought a diagnosis for physical symptoms they were feeling, such as headaches and fatigue, rather than seeking treatment for the underlying mental health issues that were causing the symptoms. Another important risk factor of suicide is the long average work week. According to the OECD, the average GDP per hours worked is 31.77 in South Korea, while the OECD average is 46.53. A study indicated that the proportion of suicidal thoughts increased according to increment of working hours per week, and pointed out that long working hours aggravate anxiety, depression, and burnout, which could increase suicidal thoughts. In response to high suicide rates, governmental organizations, mainly the Ministry of Health and Welfare and the Korea Suicide Prevention Center, are responsible for enacting suicide prevention, which include training for non-specialized health workers, follow-up care for people who attempted suicide, early identification of risk factors, and treatment of people with mental and substance disorders, chronic pain, and acute emotional distress. The South Korean government also took efforts to reduce suicide rates. For instance, in 2017, the government included suicide prevention and spread of life respecting culture in the 100 national goals, and in 2018, the Ministry of Health and Welfare created the Suicide Prevention Policy Division. Many government officials also noted that they wanted to increase targets for suicide reduction and increase budget. Park Neung-hoo, who is the Minister of Health and Welfare, also added that he aims to educate public officers, social workers, and caregivers about suicide prevention, include 10-year period depression diagnosis as part of the national health examination, and prioritize suicide prevention measures for the elderly living alone, teenagers, military personnel, the police, the salarymen, and the unemployed. The Korea Suicide Prevention Center is a major organization in South Korea for suicide prevention. The center conducts suicide prevention lifeguard training by training professional instructors. The organization also conducts the See, Hear, and Speak 2.0 program, which provides education about various signs of suicide and methods which could help prevent suicide. The Korea Suicide Prevention Center were concerned with copycat suicide cases after a popular celebrity or a politician commits suicide. In response, the center released the Suicide Reporting Recommendation Criteria 3.0, which recommends that reporters and broadcasters use the term death instead of suicide or other similar phrases, restrict the portrayal of suicide methods, and limit the tools used, location, or motivations for suicide when reporting about suicide cases. The Life Insurance Philanthropy Foundation is another organization which operates a 365-day, 24-hour SNS-based counseling service. The foundation funds and runs the We'll Listen to Everything program, which allows teenagers to reach out and talk about suicide or their feelings of self-harm. The service offers multiple platforms and connected with 55,396 teenagers in 2019 and 78,929 in total. The service also provides data to researchers as well and concluded that interpersonal relationships, academic career-related problems, and family conflicts were the most common causes of emotional distress. The Korea Psychological Autopsy Center, established in 2014, aims to analyze motivation for suicide. The KPAC organized data collected by psychological autopsies and concluded that 88.4% of people reported having changes in everyday life after a family member's suicide. Some findings of the KPAC include the fact that 92% of people showed warning signs before death by suicide, 87.5% of people had mental health problems, 64.0% had stress related to family issues, 60.9% had financial difficulties, and 53.6% had stress related to jobs. Other services offered by the KPAC include the one-stop service, the website Warm Days, which provide explanations for the mourning process and psychological support, and the National Survivor of Suicide Day Festival. The South Korean government also enacted measures to restrict people from accessing suicide means. For instance, substances that cause carbon monoxide toxicity effects and substances such as herbicides, pesticides, and fungicides have been labeled as suicide-inducing substances and banned by the government. Acts of encouraging or helping suicide by spreading information about how to use lightning coal or pesticides in order to commit suicide is punished with a 2-year sentence to prison or a fine of under 20 billion won. Similar measures were shown to be effective in an experiment conducted by the Hong Kong University Suicide Prevention Center. The religious community also made collective efforts to prevent suicide. For instance, the Jogye Order of Korean Buddhism offers the Call of Mercy 24-hour hotline service, temple stays for suicide victim families, and other various services. The One Buddhism community operates the Round Heart Counseling Research Center, which offers individual and group counseling programs, suicide prevention education for priests, and suicide family counseling. The Catholic community in Korea offers suicide victim family support programs and develops suicide prevention education manuals. Government organizations, mainly the Ministry of the Interior and Safety, also provided economic compensation for individuals amidst the coronavirus pandemic in order to reduce financial burdens of families. For instance, households received compensations ranging from 400,000 won to 1 million won depending on the number of people in the household. Small enterprises also received loans with interest rates of 3 to 4% per year, up to 10 million won, and loans up to 20 million won were awarded to some startup companies. Overall, the South Korean organizations made collective efforts to reduce suicide rates, which is reflected in the decrease in suicide rates shown in the previous data starting from 2010. Thank you for listening to my presentation.